Hi my friend, my name is Dan Hammer and this video series is directly for those who either have high blood pressure or have a family member or friend who has high blood pressure. The purpose of this video series is to help you learn how to use a safe, natural, and proven program to help you make significant improvements in your blood pressure by repairing the organ that directly controls your blood pressure. You might think that organ is your heart. It's not. Instead, it's an organ that most people have never heard of and most physicians never treat. Yet the 1998 Nobel Prize in Medicine was awarded to 3 American researchers who discovered how this organ produces a gas called nitric oxide. Nitric oxide regulates the muscle tone of your vascular system to directly impact blood pressure. The name of this organ is the endothelium. And we'll talk more specifically about this organ and its function in just a little bit. But let me highlight several items. First, there is a silent epidemic occurring here in America, and it all centers around high blood pressure. Currently, 1 in 3 American adults, or approximately 70 million, have some level of hypertension. This means that if you're in a room with 100 adults, there's a good possibility that 33 of them have high blood pressure. Unfortunately, many of them may not even know it, since most with hypertension do not have any symptoms until it's too late. According to the American Heart Association, high blood pressure is the 13th largest cause of death in the United States. That's bad enough, but when you consider that high blood pressure is the leading cause of stroke and is a major contributing factor for both cardiovascular disease and the complications associated with diabetes, you really need to pay attention to this information. Second, if I haven't impressed upon you how important it is to pay attention to your blood pressure, then let me put this statistic up on the screen. According to the famous Framingham Heart Study, it's estimated that a 55-year-old person who has a normal blood pressure has a 90% lifetime risk of getting high blood pressure. High blood pressure that can cause damage to the blood vessels of your eyes, leading to blindness, your heart, leading to a heart attack, your brain, leading to a stroke, and your kidneys, leading to kidney disease. This means that you need to get an annual checkup by a qualified health professional who can properly assess your blood pressure. Third, this information directly impacts the baby boomer population. Every 8 seconds, a baby boomer turns 65 years of age. Combine this fact with the information from the Framingham Heart Study about the increased risk for high blood pressure, and baby boomers are on a direct path to high blood pressure. It's critical that they take the steps to educate themselves and learn how to reduce their risks. Fourth, the typical treatment program is usually pharmaceutical drugs. I'm not against using pharmaceuticals to help with your blood pressure issues, but understand that most only help solve the symptoms and do little to correct the underlying problem. And they usually come with unwanted side effects. It's also important to understand that they don't always solve the problem. According to Baylor College of Medicine, only 27% of Americans who have high blood pressure have their blood pressures effectively controlled. Because high blood pressure can have multiple causes, effective management is usually not achieved through one drug. Optimal management requires a broad-based approach from diet to pharmaceuticals to nutritional components. In this video series, we hope to educate and enlighten you on a safe, natural, and proven approach that helps to address the one organ you must pay attention to if you want to effectively manage your high blood pressure. Again, that organ is your endothelium. We want to help you understand how your endothelium and its ability to properly produce nitric oxide, the master signaling molecule of your entire cardiovascular system, can aid you in proper blood pressure regulation. This way you can work directly with your healthcare provider to implement a comprehensive strategy to controlling your blood pressure so that medications can be used as little as possible, if at all. Now, let me take a few minutes to explain this vitally important organ. As you can see by the slide on this video, the endothelium is a one-cell thick layer that lines all of your cardiovascular system. Your heart, arteries, capillaries, and veins are lined by the endothelium. Because it's only one cell thick, many scientists thought it was just an inert membrane, whose only function was to keep the blood in the circulatory system and out of your body's tissues and organs. To help you understand the lack of interest in the endothelium, and why your doctor may not have told you anything about it, I'd like to put the following statement on the screen. In researching information for this video series, I came across the following statement from a 2003 copyrighted article from the Canadian Association of Cardiac Rehabilitation. The article is entitled "The Endothelium in Hypertension," and according to the author, many years ago, when I did my basic science training, the endothelium was considered a nuisance, interfering with important studies on vascular smooth muscle. As such, it was dutifully scraped off arterial segments prior to any studies on the latter. We now know that the endothelium plays a pivotal role in determining the function and the structure of blood vessels. Although we still don't fully understand its role in hypertension, it is recognized that the endothelium is likely the major determinant of blood pressure at a vascular level. Research over the last 25 years, especially research in the last 10 years, has clearly shown the endothelium to be an active, multifunctional organ that plays a vital role in metabolic, immunologic, and cardiovascular health. Scientists now believe that your endotheliums and your endothelial cells ultimately determine the health of your blood vessels and play a major role in preventing cardiovascular disease and controlling blood pressure. To give you a conceptual idea on how large this organ is, if you took out all your endothelial cells, laid them down on a flat surface, they would cover the surface area of 4 to 8 tennis courts, depending upon the size of the individual. That's a huge amount of surface volume that can be directly damaged by high blood pressure, resulting in improper production of nitric oxide. We'll talk about nitric oxide in the next video, but let me conclude this video with the following information. Blood pressure is a measurement of the force exerted by your blood as it travels through your vascular system. When your healthcare provider measures your blood pressure, they're recording two numbers, your systolic and diastolic blood pressures. When your heart contracts, it sends blood into your arteries. It's this head force of your blood as it pulses through your arteries that's being measured as your systolic blood pressure and is the first number that your doctor or nurse records. When your heart is relaxing, your blood needs to have pressure sufficient enough to return the blood to the heart and properly fill it. This resting blood pressure is your diastolic pressure and is the second number recorded by your healthcare provider. For example, if you have a blood pressure reading of 120/70 millimeters of mercury, you would have a systolic or working pressure of 120 and a diastolic or resting pressure of 70 millimeters of mercury. In our next video, we will look at how damage to your endothelium and reduced nitric oxide production can affect these numbers. If you have any questions about this information or need to contact me, then please either email me or call me directly. My contact information is listed on the screen. Or contact the person who turned you on to this video series. We're part of a team whose mission is to save 1 million lives. Thank you, and I'll see you in the next video as I share with you vital information on how damage to your endothelium and its inability to properly produce nitric oxide can negatively affect your blood pressure.